Diabetes mellitus, also known as the silent killer because of its unrecognizable symptoms until further complications, is dangerous than most people assume. 10 million total cases of diabetes in adults last year have been found. In 2017, approximately 425 million people ranging between 20 until 79 years old were living with diabetes. By 2045, this might rise to 629 million. In Indonesia, diabetes was the fourth leading cause of death by disease in 2016 and has the prevalence of 2.1% that has been diagnosed and mostly affects women. Despite these eye-opening statistics, people in Indonesia are still underestimating this issue. There are several main problems that we are currently facing right now. The first one is the lack of people's awareness towards diabetes prevention. The lifestyle of Indonesian people is still revolving around sugar. It can be proven by the fact that Indonesians consume rice as their primary food and their tendency to drink sweet beverages for their daily intake. According to the data of Ministry of Health, unbalanced diet and excessive sugar intake per day is the most contributing risk factor for DM type 2, which is around 53% in Indonesia. The second one is self-care problems. After being diagnosed with diabetes, people are often faced with low self-esteem, lack of motivation, and a general sense of negativeness because of the lack of support from their friends and family, which can lead to the discouragement on continuing their diabetic medication. The third one is the underfunded situation of BPJS Kesehatan, or Social Insurance Administration Organization for Health. The problem is started from the fact that the premium rate is really low despite the fact that BPJS covers most expenses regarding healthcare for individuals. After further discussion from journal reading and interview from several sources, we have concluded our proposed solution to these complex problems. The solution we have offered are as follows. First is by promoting healthy lifestyles by increasing campaign about diabetes prevention and treatment to the public. This can be promoted in many platforms such as posters in hospital and advertisement in several medias. The second is by implementing a hotline dedicated to diabetes. The hotline will provide all helpful information for diabetic patients that have registered by reminder messages and requested phone calls. The call center will be serving as a qualified consultant in diabetes. The third is by increasing the premium. This solution could be really helpful to solve the deficit for the BPJS Kesehatan that Indonesia has suffered. After all the solution, we really hope we can reduce the prevalence of diabetes in Indonesia and encourage diabetics so they can live healthy and fulfill their life without any disturbance and desperations.